as we continue to see more cases of respiratory illnesses going around, the question of do I need antibiotics pops up quite a bit. Here are a few things to think about to help you to know if you might need antibiotics. One is antibiotics are used to treat bacterial infections. So if you have a viral infection, antibiotics are not going to help you to get that better any faster or prevent things from getting worse. If you're having fever that's lasting longer than 3 days consecutively, if you're having a temperature over 101 3 days consecutively, then you will want to talk to your doctor and be evaluated to see if antibiotics are appropriate. If you experience green or yellow mucus, that's something that a lot of people talk about and concern that once that happens that you might need antibiotics. That is not an automatic sign that you do need antibiotics due to bacterial infection. You can also have green or yellow mucus due to viruses. If your symptoms are getting worse after you were getting better initially when you were going through an illness, that is something definitely to talk with your doctor about, because that can be a sign of a super infection that may require antibiotics to treat a bacterial infection that has set in. Sinus infections are typically caused by viruses, and those symptoms will usually last about 7 to 10 days. But if you're having a sinus infection that lasts longer than 10 days, you do want to talk to your doctor about if antibiotics are appropriate for you. And that's very similar to bronchitis as well. Bronchitis also generally starts out due to viruses, but if it's persisting longer than 10 days, then that can be a sign that there's bacterial infection that may need antibiotics to treat as well. Sore throat that you have fever without any cough can be a sign of strep throat, so you'll want to talk with your doctor about being tested for that. And our last tip is urinary tract infections. If you're having urinary symptoms where you're having burning when you urinate, or urinating more frequently, or your urine's very cloudy, you'll want to follow up with your doctor to have urine tests done, because you may need an antibiotic to treat a bacterial bladder infection. So hopefully these few tips gave you some insight to talk with your doctor about whether you may or may not need antibiotics. And antibiotics used when not needed can increase the risk of resistance so that they're not effective when you do really need them. So be sure with talking with your doctor about if antibiotics are appropriate for you.